everyone. Welcome back. Once again, I am Deanna, and I am so lucky to be joined once again by Dr. Farshid Afsarifard. Hi, Dr. A. How are you?
Hi, good, thank you. How are you doing?
Doing well, hanging in there.
Yes,
The sun is shining, so we'll take it.
yes.
Um,
Hey,
I have a very special question for you today. First and foremost, both personally and professionally, Premier supports all of our healthcare professionals out there. But my assumption is that self-care for somebody like me who's working from home is going to be different than a healthcare professional that is out there engaging with folks. So the first question that I'd like to ask you is if you can provide us some helpful strategies to all of the healthcare providers out there right now.
yes, healthcare providers, as they call them now, frontline people, are being put in a situation where they have to deal with this pandemic in a very different way. They're being referred to as the heroes, which they are, and everyone is grateful for the work that they do. And they always prepared themselves through their training and through their own personal drive to be those types of people, to jump in and to try to take care of other people. At the same time, they are in a position where they are responding to an extremely stressful situation, whether the volume of patients that are coming through or the type of problems that they are feeling and they're experiencing. Uh, I don't recall any other time in our history where they had to worry about supplies and basic necessities to do their job. So they're dealing with all these issues while they're trying to take care of some of the most difficult patients out there. And to just put it mildly, it's stressful. But in a lot of direct care situations, it can be traumatic to a great extent. The definition of trauma is when you're exposed to a lot of stress at one time that is threatening you or people that you care about. So that's where they're at. So they do need to have their eyes on themselves as well. Uh, Unfortunately, as we say in healthcare, healthcare providers, doctors, nurses, mental health professionals are very good at giving the care, but not so good at receiving it. We're not good at asking for help and asking for treatment when it's needed. So it's really important for people to focus on what do I need in order to be a good, prepared warrior in this difficult time.
Perfect, perfect. Now, what would you recommend for people who are truly on the front lines, whether they be nurses or the physicians that are really seeing the patients that have COVID-19?
Yeah, we're getting some calls from those individuals, and they are, again, responding to a tremendous amount of stress. They are rarely concerned about themselves. One of the main issues that they are concerned about is how, when I come home, am I going to infect my family members, my children, my spouse? And also, are we doing enough for our patients? Are we sometimes that feeling of helplessness because of the volume again and lack of knowledge about the virus and how it's affecting the patient population? So it's really important to prepare. Now, again, a lot of analogy has been made about war, and this is war, and these are warriors. And they are, as I said, warriors. We need to prepare them, not just medically and technically, but also psychologically, to prepare to engage in better self-care, to do more work in terms of replenishing themselves. Many of them are working extra shifts because they're skilled workers in specific areas and they can't be replaced by other people. You cannot just recreate ICU nurses or intensive care doctors. So they're getting taxed in that way too. So they do require a lot of replenishing emotionally and psychologically. So it's the sooner we head this off, the better they're going to be in the long run. So calling and getting the help that they need. I know a lot of nursing groups are talking to each other and they're spending time supporting each other, and that is extremely helpful. But sometimes, especially if someone has a pre-existing problem with anxiety or depression or other adjustment problems, getting some help early on is the key to not making this into a chronic problem.
Perfect. That is so great. Thank you so much for your time. We appreciate it. It's always a pleasure to see you.
Thank you. It's great to see you as well.
Thank you, everyone, for watching. We really do appreciate it. And once again, thank you to all of our first responders and all of our healthcare professionals who are out there. We truly appreciate you. Thank you so much. If you have a question for any of our providers or Dr. A, please let us know, and we're more than happy to answer that for you. Take care.
Take care.